surgeon. I'm here with Dr. Stephen Lewis, who is an orthopedic surgeon at Hinsdale Orthopaedics, and we're talking about knee replacement surgery. Dr. Lewis, there are so many different types of knee implants out there, customized for women. You know, we hear about different ones for athletes. How important is it to get a customized implant?
True custom implants where they were specifically designed for one person are very rare. You need a special condition or a real problem that needs that kind of attention. The knee replacements that seem to be advertised out there as custom really are off-the-shelf normal implants. Gender specific or a woman's knee really is just a narrower design. So some men have that same type of anatomy who may get what's called a woman's knee. So it really isn't the custom implant or the knee implant itself that I think is important. I think how it's put in, the way it's put in, and the balance of the ligaments is really the critical stage or the critical part of a successful knee replacement.
Tell us about that technique that you use to ensure success.
I use the DePuy True Match Knee, which is a CAT scan based cutting guide, custom made cutting guide that the company makes for the person, so they know exactly the mechanics of the initial two cuts for the knee replacement to be as perfect as possible, because it's computer designed. It is not a design, it is not a guess by me using some less perfect implants or guides intra-op. It's done before the surgery.
And how does a patient know if they need a total replacement or if they just need partial?
Knee arthritis comes in different packages. There are 3 compartments in the knee that we talk about, and if all 3 are affected, you get a total knee. If only one is really affected, you can get a partial knee. But that is a real stopgap measure. It's designed for a younger person with only one-sided or one compartment arthritis who's a little more active, that knows that whatever they get, they're going to need a second operation down the line, which then would be a total knee replacement.
And for those patients out there who are interested and want to do this, what's the key to successful recuperation after you've had the implant?
It's an understanding by the patient that a total knee replacement is a commitment from them to do the post-operative course. They need to have a lot of perseverance and be compliant and work really hard with the therapist. That's the main real determinant of how well a knee does.
Thank you, Dr. Lewis. And again, besides knees, Dr. Lewis specializes in anterior hip surgery. In fact, he has done over 220 of these procedures, and it's a new, less invasive approach to hip replacement that involves quicker recuperation and ultimately better results for patients. You can find out more about his knee implant procedures that he's done, and also the anterior hip surgery, by logging on to hipandtrauma.com or calling Sabina at 630-323-6116. Thanks again, Dr. Lewis.
Thank you.